Namaskar, I'm Manoj Kumar. Welcome to my program Meet Experts. Today, you'll meet Dr. Munish Chauhan, Associate Director, Department of Nephrology and Kidney Transplant, Max Hospital, Mohali. He talks about robotic kidney transplant. He says India is the diabetic capital of the world. Diabetic is leading cause of kidney failure. He also talks about what are the reasons of increasing sugar level and how to control sugar. According to him, keep yourself healthy. Healthy means begin with good food, do exercise, maintenance of weight is important, eat less of sugar and carbohydrate. So without spending so much time, let's meet Dr. Munish Chauhan.
Robotic transplant is a kind of surgery. It's a kidney transplant which we are doing by using a robot. So robot is used for so many surgeries, but it is now being used for kidney transplant also. So there are advantages of using robot in kidney transplant. The first advantage is it will be incision of the patient will be very small, recovery will be very fast, and then when you use a robot, आपकी जो vision है that improves a lot, है ना? 20 times magnification हो जाती है, chances of bleeding कम हो जाते हैं, chances of infection are less, and recovery is fast. So any technique जो कि क्योंकि kidneys are precious, जब भी आप transplant करते हो, you don't get so many kidneys, है ना? आप आज के टाइम में भी there is scarcity of kidneys, or you will try to use that technique which will give you best result, है ना? So for this, robot is a good option जब भी आप kidney transplant करते हो. No, it is not the first time in India. It is being used for so many years in India. But yes, the availability of robots was not there in various centers. PGI maybe I think for the last few years only they have started doing robotic, but they have still not done any robotic kidney transplant. They have done other robotic surgery, but not kidney transplant. And then robot is a costly affair, which small hospitals I think will be difficult for them to afford. And then abhi धीरे धीरे the availability is going from metro cities to cities like our city, Chandigarh, जहाँ पे ये transplants हो रहे हैं and surgeries other भी हो रही हैं. Reason of kidney failure at present times is if you see 100 patients of kidney failure, 50 of them will be suffering from diabetes. So main is the diabetes. So as you have heard that India is the capital of diabetes. So there are so many diabetic patients, and when this diabetes it persists for say 15-20 years, maybe in some patients after 5 years or 10 years, it affects the kidneys. So diabetes is the leading cause of kidney failure in our country. And what leads to diabetes is obesity, your genetic predisposition, and your lack of exercise. So it starts from there. It turns out to diabetes, and diabetes then it affects your kidney. Other reasons are hypertension, renal stone disease. There are certain other chronic infections of the kidney which can cause kidney failure. Yes, diabetes, why not? Once a patient has diabetes, actually it should be very well controlled. The thing is that when it starts, we don't take it very seriously, because it starts, say somebody is having diabetes at the age of 30-35 years, and he will not take it very seriously. At that point of time, I think it should be taken very seriously. He should control his blood sugars very well, and with good glycemic control, blood sugar control, good blood pressure control, all these complications they can be avoided. Kidney donors actually, are those who are donating kidneys, and kidneys can be donated by a cadaver. A cadaver can donate a kidney. Cadaver is like a dead body. A dead body can be a brain dead, it can be a cardiac dead. The other one is living donor. Because we have 2 kidneys, so 1 kidney can be donated. So in India, most of the transplant is living donor only. We don't have a setup for cadaver donor. Ideally, we should utilize more of cadaveric kidneys, but here 95% of the transplant is living transplant only. Advice is to keep yourself healthy. That is very, very important. Healthy means to begin with, you should eat good food. Okay? This is very, very important to begin with. It should inculcate into your children that exercise is very important, maintaining your body weight is very important, eat less of sugars, eat less of carbohydrates, keep yourself healthy and fit. And otherwise, if there is anything in your genes, you can't change that. But you can change whatever is we are eating, what we are doing, you can do exercise, all these things can be changed. You can't change your genes, but you can change your environmental factors which can affect your health. If a person goes for kidney transplantation, then the survival of kidneys is short-term survival and long-term survival. Short-term survival is very, very good in recent days. Short-term survival is like 5 to 10 years. It is like 70 to 80% of the kidneys, they will survive for 5 to 10 years. But long-term survival for 15 years, 20 years, 25 years, it is around 30-40% only, है ना? So most of the kidneys will survive for 10 to 15 years whenever you go for a kidney transplant. And maybe there are few lucky ones, those they can have their survival for maybe more than 20 years, 25. Maybe 20-25% only, those who will have survival of maybe more than 20 years.